All right, good morning. We're going to start out with practice management, and then we're going to go into technique. I got about an hour and 45 minutes somewhere, so what we're going to do, I'm going to go for a while on practice management, then we will stop, answer some questions. Anybody needs to use the restroom or whatever, but I get on a roll. It may go straight through, so we'll just see what happens. Some of you guys know me, some of you don't. I'm practicing in Oklahoma City. Been in practice 17 years, and what I'm going to do is I'm going to present to you guys my version of practice management. That's the only thing I know. And I've seen some other things that are out there, but the only way I can teach or show you guys anything that I think is important is basically let you know what I do. Now, when I first started in practice 17 years ago, I was an associate doctor for 3 different doctors for the first 3 years. And I'll just simply put, that was a bit of a nightmare, but I learned what I didn't want to do. When I went out on my own, I learned from the right way of doing it, and after I learned, I went out on my own. In my first year, at the end of my first year, I was seeing more patients than all 3 of the other doctors combined. And so that was 17 years ago. So what I'm going to do is I'm going to talk about the type of practice management, or the type of practice. We won't call it management. We'll just talk about the type of practice that I think that everybody strives for, but a lot of people have a misconception about. And it's basically what I call a total package practice. You're going to hear a lot of people talk about, their practices, and they'll talk about, how many patients they see a week, which is great. You want to, our objective behind chiropractic is to help as many people as we can. But when you ask them, well, what's your overhead? Well, that doesn't matter. Or, well, all right, well, what's your collections per visit? Well, you shouldn't think about that. It's kind of hard to tell someone straight out of school that has a $200,000 student loan that you shouldn't think about how much they collect, because they've got to pay those bills back. And I see a lot of offices out there that they see 1,000, 1,200, 1,500 patients a week, but it's $50, $60 a month unlimited visits, so they're basically making $1 a visit. It doesn't make a whole lot of sense to me. Those same practices are working 6 days a week, 60, 70 hours a week with an 80% overhead. So what I will tell you is, after 17 years, I will tell you what I do and how I accomplish that, and then you guys can adapt it to if it's something that you think you'd like to do or not. We'll make it real easy. Here recently, and actually, I've actually, after 17 years of practice, you'd think a lot of guys that I know after this many years of practice, they start kind of thinking about maybe slowing down a little bit, or just kind of even it off. And what's fun is I can't wait to get back in Monday and see what we're going to do next, because we're really starting to ramp it up. Here's my hours. I work Monday, Tuesday, Wednesday, 9:30 to 12:30, 3 to 6. So I'm 18 hours a week. Now you're going to hear a lot of people say, well, my biggest day is on Friday. You can't work Friday. Or my biggest day is on Friday mornings or Saturday mornings. And that's just kind of silly. I say, well, and I will say this because I talk all over the country, and I counsel with doctors all over the country. And I will tell you that in Oklahoma City, where I'm at, is no different than Boulder, Colorado, or Nebraska, or California. People are people. They all have spines. They all have jobs. They all have busy schedules. So the whole, well, that won't work here doesn't hold water, because yes, it does. So working 3 days a week, 6 hours. I've got 2 girls. I have 2 staff members, and they've been with me about 11 years. This last week, 2 weeks ago, we saw 590 patients in those hours, and I had about 3 hours of downtime. And the way we do things, I dictate how my practice is running, how smooth it's running, on how much actual downtime I have. I will tell you, the week before my 600 that week, we saw 556. Come on, Corey, 556, and where I stand in my office, I can look out the door, and I have seats like this where patients sit, and then there's a waiting room, but I can see out the door. We had a traffic jam out in the street. Every parking spot I had my own building. Every parking spot was full. The street was full. They were parking across the street. People were standing outside waiting to get in. It was a zoo out there. It was stressful because people were waiting, and and I'll get into that, but I don't like people to have to wait. So the type of practice that I run is low overhead. My overhead's 20%. And the reason it's that high is because I pay my girls so much. They've been with me a long time, and they run the show, so they make a lot of money. They actually make more than I did my first 3 years of practice. It's kind of sad. I remind them that sometimes, and they get a little spoiled. But so we have a 3-day practice, 20% overhead. and my collections have not been under $1 million in the last 6 years. Now, when I do this presentation, and I've done it several times, there's a lot of doctors that they don't want to talk about collections. They think that you're taking away from the patient, or they don't want to talk about volume. Oh, you high volume guys, you don't really care. You're just rushing them in and rushing them out. I'll address it this way. I run a 100% strict referral practice, word of mouth. I do no advertising. I do no screenings. I'm not at the malls. I don't do health talks at night. My practice is based off of getting a patient well and they go tell someone else. And I saw 90 new patients last month. That's working 3 days a week. Majority, I won't say the majority, 30 to 40% of those patients were under 2 years old. I treat infants, babies, children. I have pediatricians referring me. I mean, every colic, every ear infection, every sinus, every allergy, they're coming to my office. So the total package practice is, basically what we say, and I've got it written down. What I think a total practice is you want time, you want money, and you want patience. Now, doctors, some of you, I don't know where you all are in practice, but I know a lot of doctors who just get started in practice. They're going to work, and I work Monday through Saturday. And Sundays, if somebody would listen to me or lay down for an adjustment, I'm giving it to them. You're going to do that for a while, and it's going to get old. You're going to get tired. When I first started out in practice, I would pay them to come in. Please, just come see me. I wouldn't. My wife was so mad at me. She'd come and work in the office a little bit, and she's like, okay, they're not paying anything. Well, they're having this problem, they're that problem. I just wanted someone in front of me. Reality sets in. The world sets in. You got a wife, you got 3 kids, you got colleges, you got schools, you got houses, you got these things. And so I think what happens is the chiropractic community, for whatever reason, a lot of them that I've seen have developed a poverty complex. They think that we shouldn't be successful as chiropractors, that we shouldn't get paid as chiropractors, and I think that's ridiculous. Here's the thing, we're doing something that no one else can do. We are, and I have patients that say, this is a patient's word, miracle worker. What happened to my child is a true miracle. No one else can do that. But yet, no one has a problem going to a pediatrician and paying whatever, or going to a surgeon and paying hundreds of thousands of dollars, or going to a hospital and paying $1,500 a day, and no one even walks in. That's perfectly acceptable. No one questions that. But yet, when you go to a chiropractor and you have miracles performed in the office and save a child's life, and we're supposed to give that away, it doesn't make any sense. It just doesn't make any sense. And so what I'm going to do is I'm going to talk about how you develop that type of practice. Okay? The reality is, with patients, and this is just truth, and I will tell you my truth because it works for me every single day, every single week, year after year for 17 years. It hasn't let me down. Here's what patients want to know. Let me backtrack a little bit. I recently had this discussion with a doctor he's actually still in school. He's a patient of mine. He was a patient of mine. We was in the same gym. He's a power lifter. He decided to go to chiropractic school. He saw what I was doing and wanted to do that. He's down in Dallas, and he got in with this group. And this doctor down there, she's got this practice, and she's trying to start her own little practice management. And here's their theory. We don't put our patients on treatment plans. We just we tell our patients that, or our practice members, that your innate will tell you when you need to be adjusted. You just let us know when your innate speaks to you. Really. Yeah, it's $75 unlimited visits a month. So whenever your innate tells you need an adjustment, just come in. Okay. Here's how I addressed that. I told him, I said, here's what it takes to have a successful practice. You have to have 2 things. One, you have to have a sense of responsibility. You have to have a sense of responsibility to your patients to tell them the truth and to get them well. They get in their car, they drive a long distance. I have patients that drive 2.5 hours one way to my office. There's 4 of them, and they do it Monday, Tuesday, Wednesday, and they have done it for the last 7 weeks. You have a responsibility to their health and to their condition. If they come to you with whatever they come to you, it is your responsibility to detect and find the problem, and then let them know what that problem is, and then let them know what it's going to take to correct that problem, and then follow through on your recommendation. To just simply say, you let me know when you need it, and they're trying to, what this whole theory is that we're not a pain-based practice. Well, yes, you are. Because if a patient says, well, I'll come in when I hurt, what is that? So they're not correcting anything. They're not wanting to treat. So you have to have a sense of responsibility to your patients. And we talked about this a little bit last night. You have to have a sense of responsibility to tell them the truth. So when you put them on a treatment plan, and I'll get into treatment plans here in a minute, but when you tell them your recommendation, you can't bat an eye. You've got to believe. And that goes to the next thing. You have to have 100% ownership of what you do. This is the second problem I see with chiropractors, is they don't believe in chiropractic. They don't believe in it. They don't believe that all you have to do is make an adjustment and someone's going to get better. If they did, they wouldn't have every gadget and widget in the world. I mean, I've seen there's offices that the patient is truly in that office 1 hour every visit. And they have everything in the world, and then the very last thing they get is an adjustment. But then the chiropractor comes in and adjusts every bone in their body. They don't believe in chiropractic. And so if you don't believe in the power of chiropractic and what it actually can do, you're never going to have a referral practice. You're going to constantly have to market. You're going to have to look for the new greatest thing. The way I look at running a practice is the way I look at how chiropractic works in True Health. As chiropractors, what do we say? Healing comes from where? Above, down, inside out, right? That's how it works. Medicine says, we'll treat you from the outside in. We will give you something so you don't feel the inside until that something wears off, and then when the inside starts feeling it again, then we'll do something else, and we'll constantly keep doing something else so you never have an internal healing. It's a constant trick. It's a constant facade, right? That's what medicine is. Well, that's how I kind of look at constant marketing and advertising and screenings and all this stuff to build a practice. You're constantly having to go out and do something or buy something or make something look shiny and new for people to come in. But when that new wears off, they're gone. And so you got to go do it again. You're constantly having to do something to get new patients to keep your practice going. So it makes sense to me that if you build your practice from the inside out, like health, you don't have to do that anymore. Your practice is healthy. When you have a healthy practice, it heals from the inside out. You don't have to do anything but have ownership in what you do and responsibility to your patients. And I'm going to try to get into this. I'm going to try not to rattle on. Go back to what patients want. Here's what patients want. And I've had this argument with, and I'm one of the big, Tim knows this, I'm one of the biggest philosophy guys. I live it, breathe it, sleep it. That's why I started Focus. I love it with everything I have. But here's reality. We're dealing with people out on the street. Your mothers, your fathers, your uncles, your aunts, your attorneys, every walk of life that you can possibly imagine comes to a chiropractor, and there's 4 things they want to know. What is my problem? Can you help me? How long will it take? And what's it going to cost? That's all they want to know. That is it. And if you think about it, and this is why most chiropractors have a problem with this, because they've never truly been in pain themselves. If it wasn't for pain, none of us would have a practice. Because you do not have a patient walk in off the street and say, I want you to check me for subluxations. I feel fine, but I just want to make sure I'm not subluxated. That didn't happen. That's ridiculous. They come in and say, I hurt here. I have a migraine. I can't feel my fingers. My foot hurts. My back hurts. My neck hurts. That's why they come to your office. Now, you can educate them along the way, but when they walk into your office, I have a problem. Can you tell me what it is? Yes. Can you help me? Yes. Which is the most important part of this whole talk is hope. Can you help me? The answer is always yes. Whether or not physically you can help them, but you can get them to the right person. I referred a patient one time for spinal surgery. Took an x-ray, couldn't really see what was going on, but because of his symptoms, I knew something was weird. Sent the MRI, he had a total rupture in annular fiber, and that spinal cord was pushing all the way out into the spinal fluid. Or the spinal fluid was actually leaking out into the disc and everything. No wonder he was in so much pain. I mean, they had him surgery immediately. He calls me from the hospital bed when he woke up, called me from his cell phone to thank me. Treated his whole family. So you have a sense of responsibility, but the thing is, they need hope. So the word is always yes. Can you help me? Yes, always. How long is it going to take? Okay, we're going to get into that on a report of findings and what's it going to cost. And then I will get into that also. So we're going to kind of backtrack. So here's what we're talking about. You guys are here, and this class that we're teaching is practice management. So you're going to manage a practice. So now you have this practice, and you're going to manage it. You're going to try to be as successful as you possibly can. That is a different level for everybody. I get that. It's taken me a long time to get that through my head, but I get it. Not everybody wants to see 200 plus people a day. I get that. It's hard for me to understand it why you wouldn't, but I get that you don't maybe. But I will tell you this, even if you're only seeing, let's say 20 a day or 30 a day or 40 a day, or whatever you want to see, wherever you're at or wherever you feel comfortable at, no matter what that number is, you still have to have a sense of responsibility to those patients. And I will tell you, you have to manage it appropriately, not only for their health, but for yours. We're going to kind of get into this on technique class, but I will tell you this, the type of practice that I'm going to help you guys with, I'm going to show you and kind of expose you to, will help you continue after 17 years of continuing doing this. And I feel like I'm just getting started. I'm having too much fun. You know, we're averaging right at 200, almost 200 people. Every Monday we see between 200 and 220, every Monday. You know, I've got a new saying in the office. My girls, and they roll their head. But, you know, we have, you know, I know you guys use face paper to lay it down here, but, you know, the paper rolls on your table, when you roll it and tear it, I say 1 by 12. That's my new saying. Hey, Denise, I say 1 by 12. I want one paper roll gone by 12 o'clock. I start at 9:30, so 2.5 hours, that's 100 people. And I've done it twice in the last 2 weeks, so it's kind of a fun thing for me to do. So here's what we're going to talk about now. We're going to talk about when patients come in, you know, can you help me? So what we do is in our office, you've got to, our job, we have one job. As chiropractors, we really have one job. Find the subluxation. Patients will come in, we'll do a consultation, and it's really simple in consultation. When they, you know, and I don't know how long a lot of your guys' consultations are. My consultations are a lot of times about 45 seconds to a minute. About a minute is my consultation. Because it's real simple. They fill out the paperwork. And on the paperwork, you can look down and you can see everything that you need to know. But I'm going to ask them, what's the number one thing bothering you right now? Now, let me ask you guys this. And some of you doctors, you don't have to answer this, but think about it. Patient walks in and tell me what's wrong with you today, or tell me what's going on. And 25 minutes later, after they've told you about being kicked by a horse in 1962, and then their mother's got diabetes, and, you know, my whole family has osteoarthritis, so I know I've got it too. You're going, okay, why are you here? You know, so it's real simple. If you cut out words and cut out time and cut out energy, most of the time the reason a practice is slow, or the reason a practice gets bogged down, or a reason that a lot of doctors don't want to see a lot of people, because they're thinking, well, if I do it the way I'm doing it now and I add any more, I'm wore out, I'm tired, I don't want to do that. It's because there's so much wasted time and so much wasted movements. So when a patient comes in, they sit down in my office, and I have one adjusting table. I see 200 plus people with just one table. I don't walk. I walk from here to there and open the door. My patients walk. And when I open the door, they leave me. I don't leave them. You know, when they're done, they walk out. I think it's rude for me to walk out on them. So when they sit down, what's the number one thing bothering you right now? I got neck pain. Is it sharp? Is it dull? Does it radiate? How long has it been there? Left side, right side. Is there anything else that's going on that I might need to look at or check with? No, that's about it. I got neck pain here and headaches sometimes. Let's get you next door and get some pictures and find out what's going on. It doesn't take very long. You don't have to put on a production. You don't have to teach them. Let me ask you guys this. If you go to the dentist with a severe toothache, I mean, that thing is killing you. Do you want a 45-minute consultation or a 3-day report of findings? Or do you want that thing fixed right now? You want something done right now. You don't want your time wasted. When they walk into your office, first of all, they're nervous, unless you run a referral practice, and then they're not quite as nervous, because when you run a referral-based practice, those patients have already said, look, this person is the greatest person in the world. They'll take care of you. They will not hurt you. They're going to help you. So when they walk in, they're already at ease. They already feel like they know you. That's another advantage of not doing screenings. No, they don't have no clue what they're getting themselves into. That's why I don't like advertising. I've never advertised a day. I've never had a phone book ad or any of that. I think it's unnecessary, because all they're doing is they're looking at an ad, and they're like, well, they're close to me. I'll walk in. The patients I've had, where I'm at my location now, I've been there going on 9 years, and I've had 4 people walk in off the street in 9 years. You can't even find me. I'm not even visible. Who here has been in my office? Some of you have been there. You can't. It's like off the beaten path. I mean, you have to know exactly how to get there. There's no drive-by, none of that. Those patients that just walk in, they never stay with you, because they're just wanting to see how much you cost, or they don't know what's going on. But when someone refers them, they stick with you. So when they come in and you do that consultation, you find out what's wrong immediately, whether it's lower back pain, whatever their symptom is. And I don't treat the symptoms, but you've got to address it. That's why they're there. If you don't address it and you just slough it off, well, then that's disrespectful to that patient. They just got in their car and drove a long ways to come see you because they have a problem. They have pain. They have this or they have that. Their child has asthma. You better address it. But it doesn't take an hour. It takes a minute. What's going on with Susie? Well, she has asthma. How long has she had it? Since she was 2. Okay? Where have you had her? Well, we had her pediatrician, and they're doing this, this, and this. I'll tell you what, we're going to stop all that. We're going to take care of Susie right now. And you're done, and you move on. Okay? So once you get done with the consultation, so now they're saying, okay, here's my problem. Can you help me? So what we're going to do is we're going to figure out if we can help them. So we go next door. I've got digital X-ray. I don't know if some of you do or not, but it's the greatest invention in the world as far as I'm concerned in a practice. One of my girls, Krisha, that takes my X-ray, she can do a full set of films in about 3 minutes. Normally I have one, as she goes, when a patient goes in and they do that, another patient comes in, I'm treating them. Typically by the time I'm done treating 2 patients, which is about 2 minutes, 2.5 minutes, then the patient's ready for me to come in. Now here's the thing, exams. A lot of patients, I know doctors that do 30-minute exams, and they brag. Well, I do the most thorough exam in the world. That's wonderful. Did that patient get well off that exam? Did they improve their health at all from your exam? Were they overly impressed with the amount of knowledge and orthopedic memorization that you did for that exam? No, they're not. You only need, here's the thing, and I don't base it off this, but this is the truth. You only need one positive orthopedic finding for insurance to pay. So if that's your concern, one orthopedic finding. Pain upon palpation is an orthopedic finding. You don't even do anymore. So when I walk in my room, my patients are already laying face down. I tell them to touch the places that bother them the most, lower back, neck, whatever the condition may be. I palpate that area. 17 years and almost 400,000 adjustments. I'm pretty good at palpation. Work on that. Palpate the area. Whatever orthopedic, if you want to do an orthopedic test, that's fine. I do a gentle stretch wherever it is. It takes all of 5 seconds to find out where this area is because the x-rays are going to show me what the problem is. More than 99% of the time, that's what we use. I hope everybody here is using x-ray. I'm not really wild about the chiropractors out there that don't x-ray. I think it's like a surgeon putting a blindfold on. How many times have you, I don't know if you have, but I have many, many times. I've taken an x-ray of somebody that they come in with migraines and they said, well, my lower back bothers me sometimes, and they're in their 40s, and I'll take an x-ray, and they've got a spondylo grade 5 sitting like that. And I said, you have no lower back pain at all. Well, no, my back doesn't hurt, but my big toes, I don't feel those. Can you help that? You know, so you have to take films or you're just working blind. Pain upon palpation, I set them up, and this is what I say. So here's the thing. I walk in the door, they're laying face down, so you can time this. Touch where it hurts you the most. I palpate that area. I do a gentle stretch. Does that make it feel better or does that make it feel worse? This is on a lower back. This is just an example. That feels better. Perfect. That's what I needed to know. When I stretch it and it took pain off of it, we know the joint is mobile. We know if the pain goes away when I do that. What's that telling us? There's a subluxation in there. It's putting pressure on that nerve. If I gently stretch it, it moves it. So we're going to correct this thing. Sit up and face me. And then I will say, Corey, look, here's the thing. In your spine, you have each vertebra moves 14 different directions at any given time. There's over 300,000 nerve fibers that run up and down your spine. So I'm going to study your films, and I'm going to make sure I didn't overlook anything. I want you to put ice on that about 15 or 20 minutes, and I'm going to have you come back tomorrow, and I'll have answers for you if there's any questions. And then they're out the door. I've answered everything that I needed to answer. Okay? Now, I'll have questions here in just a few minutes. So kind of if you're thinking, okay, what about this and what about this? We'll get to that. So when they leave, they go out front. I've asked them if they had any more questions. No, I just told them, look, I touched them. I know where your problem is. I'm going to study your films. We're going to see if we can help you or not. I'm going to make sure. So when they come back the following day, and I always do reported findings the following day. A lot of doctors do it the same day. Don't do it the same day. They want to know that you actually took the time. And here's the thing. When I tell them I'm going to take the time to study their films, I study their films. I make sure that there's nothing there. I found three bone tumors in the last 2 years. And I didn't know it was a bone tumor. I just knew it wasn't right. And if I hadn't really studied it and really looked at it, I would have missed it because it was just really obscure. It wasn't It was just a kind of a gut feeling that I got. And 2 of them were just, you know, benign hemangiomas, but one of them was aggressive. So you don't want to miss those things. So when they come back the following day, now we're going to do a report of findings. And I know offices that do 4-day report of findings or 3-day report of findings, and they take them into a room and they show them a video and they go through all this. And I've had patients come in that have been to those chiropractors before, and they go, "You're not going to show me a video, are you?" "No, ma'am, we're not going to show you a video." "Well, you're not going to make me hold sandbags in each hand and walk up and down the hallway, are you?" "Excuse me?" I mean, these things are happening. So, report of findings. The patient walks through the door. When they come into my office, and I have a touch screen, and my x-ray comes up, and I'll say, "Corey, look, here's the problem. Right here in your lower back, you got 2 vertebrae that are out of alignment and are putting pressure on that nerve. Okay? That nerve is that pinched nerve is what's causing your pain. Now, I know this has been there for a long time. Cases like yours come in 4 different grades. It's either early or moderate. Sometimes they're late, and every now and then I'll get one that I can't help, and those we have to refer out for surgical consultation or other help. Where you're at, and depending on where they're at, it could be a 15-year-old that's a grade 1, or you could be a 40-year-old and it's a grade 3. But depending on where they're at, you're a grade 2 slipping to a grade 3. Okay. My treatment plans. Now, we're going to get into sense of responsibility, and here's something that I've had these debates with before. You go from one end of the spectrum to the other. On one end of the spectrum, I'm not putting them on a treatment plan. You come in and tell me when you want to come in. When N8 tells you or moves you to get adjusted, then come in. It's ridiculous. Then on the other hand, I've seen it. I need to see you every day for the next 40 years. Okay, here's what I know. And I've learned this from doctors who have been in practice for a long, long time. One of them, Dr. Richard Yenny, has been in practice over 50 years. And then who learned from him is Dr. Hayes, has been in practice for over 30 years. So we've got 80, 90, almost 90 years combined experience that say, and now I've got 17 years of doing this, and I will say without a doubt, I believe in everything I have, that this is the most appropriate treatment plan for a spinal condition. I see them 3 times a week for 8 weeks. It's 24 visits. It's a lot like, and I tell patients this sometimes, if you break an arm, and you go to your doctor, how long is it? They're going to say, "I want to put it in a cast." How long are you going to wear that cast? 8 to 12 weeks. It's physiology. It's the way the body heals. It's just the way the body heals. And so with the proper adjustment, we'll get into that on technique, but in the proper adjustment, in about 8 weeks, approximately 24 visits, 90+% of the time, in my office at least, maybe not in everybody's, but in my office, that 90% of the time, that's approximate time, that joint is stable. When I go to palpate, when I make that adjustment, it moves perfectly. There's no restriction. There's no muscle contractions. The patients are not feeling any symptoms. They're telling you not only are they walking better or sleeping better, they're actually breathing better. Food tastes better. Their headaches have gone away. Their asthma's gone. I mean, whatever it takes. But and once again, I'm not treating the symptoms. When they come in, I'm going to write all these things down. But when I look at an X-ray, I'm looking for the spinal misalignment. That's what we do. So it makes it real simple. So I don't even talk about their symptoms anymore. You know, somewhere along the way, maybe 15th or 16th visit, I'll ask them, "By the way, how's your headaches?" "You know what? I haven't even thought about them." That's a good sign. That means they're going away. And then we move on. But I'm not treating that. But what I'm saying is, this in my office, 24 visits is a rough average. It seems to work perfectly. Now, here's where I'll take it a step further. At the end of 3 times a week for 8 weeks, when they come in, and then now I feel like they're stable. I feel like the condition is stable. The subluxation is basically corrected. I will tell them this, and this is how I look at it. If we was to spend 3 times a week for the last 8 weeks going to the gym, working out, now we're in better shape. Quit working out now. What's going to happen? And let the patients answer that. Well, I'm going to go back out of shape. Exactly. So what we're going to do is I'm going to see you, and this is what I do in my office. I typically will say I'm going to see you in a week. So instead of 3 times a week, we'll go once a week, and then we'll go once every 2 weeks. And my goal is to get you down to once every 3 weeks for basically maintenance care. We're going to make sure this condition never comes back. Now, somewhere along the way, what I'll also do is I've got a nerve chart, the nerve chart that goes to the organs. And let's say in between the shoulders, we're treating T1 through T5. And they're saying, "Oh, my mid-back is so much better." I said, "Mary, that's great. I want to show you something. I'm glad you're feeling better, but see, this is where we're treating. See where these nerves go?" And I always point to the heart and the lungs. 20 years from now, those heart and lungs aren't going to be wore out because of what you're doing. That's more important to me than you feeling better today. You being healthy and alive 20 years from now is more important. I just taught them chiropractic philosophy. And it didn't take me a 3-day seminar. They get it. They get it. Now, what's interesting in my office is I have about 50% of my patients, me and my girls look at this, about half, when I try to start break them down like where they're not coming in so much, they keep coming anyway. I can't get them down to once a week. Can I come tomorrow? Yeah. Yes, you can come tomorrow. Can I come? I'm not ready for twice a week. Or 3 times or once a week? Can I go twice a week? I've got patients I've tried to get out of my office. They're on their 70th visit. They just keep coming. But at the same time, they refer their husbands. They're bringing their kids, their mothers. I've got 2 patients. They're twins. They're 46 years old twins. I've never seen 2 women talk so much in my life. I try to keep them from coming in at the same time, but they're amazing. One came in, referred the sister in. They have referred me almost 30 people in the last 6 weeks. It's unbelievable how many people they've referred it because they don't quit talking. But the great thing is, and I don't even schedule them. When they walk out the door, I don't schedule them. They schedule themselves. I'll tell you how we do things too, and a lot of you guys know how we run our offices, but how in my office is pretty small. Like the whole area, the patient area, is about the size of this room. And if my office is in the corner and then the front desk is right there, when I open the door, my girls, I'm looking right at them. They can see me. So we have nonverbal communication. So if this is Monday, today's Monday, and my patient walks out and I want to see him tomorrow, I do this. So we have Monday, Tuesday, Wednesday. If you work 4 days, it's Thursday. 1 week, 2 weeks, 3 weeks, 1 month. So I'll tell the patient, Corey, I'm going to see you tomorrow. Have a great afternoon. I open the door and I do that. So the girls are already writing it down. Okay, Corey, we'll see you tomorrow. And Corey walks straight out. There's no stopping at the front desk, ever. They're in and out. Many, many times a patient will get out of their car, be in the office, and back in their car in under 5 minutes. That is what they want. That's what everybody expects. If anybody here, if you ever, when are you the most aggravated? Ask patients this. What aggravates you the most about going to your doctor? Waiting. They hate it. They hate waiting. They hate spending time. Why do you think Get and Go sells more milk than Sam's? It's cheaper at Sam's, but you can get in and out of Get and Go real quick. That's what people want. Here's the thing, and now I'm going to bouncing all over the place, but that's okay. You guys will get it. People value their time. Your patients value their time more than they do their health. They do. If they don't have time to take care of themselves, they won't come in. But if they have time, if they don't have to wait, any given day I have 30 to 50 walk-ins. Not on the book, not scheduled. They just walk through the door because they know they can walk in and get their adjustment and get back out the door. That's rare. You don't find that in very many offices because they have to wait. What frustrated me was the 3 weeks ago when I saw the 556, I had 3 patients on Wednesday call the girls and say, because Tuesday was the traffic jam. I don't know what happened, but it did. They said, is he going to be as busy today as he was yesterday? Because I don't have time to wait. And I heard that, and they told me 3 different patients called. And for you guys that know me real well, that didn't sit well. All weekend long, I went through, and I've been doing this a long time. I've been teaching this a long time. I went through every single procedure that I do in my mind, and I looked at it, and I thought about it, and I went through it procedure in my mind, and over and over and over, and rehearsed it, and I started eliminating. So then we come back the next week, and I saw almost 50 more people with 5 more new patients than the previous week, and I had almost 3 hours with no one in the office. Just by eliminating silly little things that didn't. We say things and we do things, we adjust and we do stuff, and if you was to stop and really be self-analytical and ask yourself, why am I doing this? You wouldn't know how to answer it. The answer would be, I just always have. I've just always done it that way. But why? To manage a practice, really, if you want to practice, and like I said, I hope everyone here wants this. You want patients in your office, right? We all want patients in our office. We all want people to come in, and we want them to refer and come in. That's what we want. If you want them to come in, you better have room for them. You have to be present. You have to be ready. You have to be, if there's no one in my office, I don't get on the phone. I never, ever take personal phone calls or make personal phone calls. Matter of fact, I don't make phone calls between 9:30 and 12:30, 3 and 6, nothing. I don't read anything. I don't get on the phone. I don't do anything but treat patients and wait. If there's no one in the office, I stand at my door, here's the threshold, and I stand there and I wait. I don't sit down, I wait. I don't do anything but wait. I'm ready. You have to be ready. You have to be prepared for that patient. When you're prepared, you guys ever hear the saying, when the student is ready, the teacher will appear? When the doctor is ready, the patient will appear. But if you're not ready, if you're mentally not ready, you're not getting them. They're not coming. And a lot of people don't want to buy into that. Like, oh, well, what's the big deal? If there's no one in the office, I can do this, or I can get more things done. Okay, this more things, is that getting anybody well? No. Your 100% purpose is to focus on what you're supposed to be there for. Do not let your mind wander anywhere else other than being with your patient. And that's really hard for a lot of offices, a lot of doctors. And I will tell you this, we have CAs here? We have any CAs? Got one? Okay, good, because you already know all this. But I will tell you other doctors that don't know this. My girls never sit. They stand. My desk, their front desk is high enough where when their arms are like, when I built it, they said we want it this high. Carissa just had she just had a baby. She's 4 months old, almost 5 now. But both my girls have both got 2 girls. And so we've had 4 maternity leaves. I told them to stop it. But both of them and all 4 pregnancies, all the way up to the very last day they were there before they went on maternity leave, stood. They stood. And they were ready. And when a patient walks in the door, my CAs are standing and they're smiling and they're looking at them in the eye and they know their name and they're ready to go. Matter of fact, most of the time they're standing out in front of the door waiting on them when they come through, because we can see them when they pull up and they're ready to move. That's called being ready. Patients refer to my office because they get well, and I hear it all the time. This is the most amazing, most efficient, friendliest, kindest place I've ever been, ever. I tell people all the time, you just got to go in and witness. I don't need a chiropractor. It doesn't matter if you need a chiropractor. Go watch this. It's fun. And you got to be nice, and you got to be caring, and you got to be kind. You walk in, I will tell you, this is kind of interesting. I had a couple patients that come in here recently, and I've been treating them, they're like grandparents. I've been treating them for, since 17 years since I moved there. And they have family in Dallas, and they were down in Dallas, and then they went on to Branson, and they made a big circle down in the Midwest, and they went through Arkansas, and they got to Hurton, and they saw a chiropractic office, and they thought they'd just go in and get an adjustment. What's funny about it is the wife is pretty heavy set, and then they're old, they're in their late 60s, and he comes in, and he said, you just don't, he said, you need to realize how great your staff is and how great your office is. And I said, John, I do. I really appreciate it. He goes, no. He said, let me tell you something. We walked into this office, and he said, and I got this big old fat girl sitting there behind the desk, mad about being there, scowl on her face, looked up at me like I was bothering her when I walked through the door. And I felt uncomfortable because his wife was sitting right there when he said that. Like, okay, John, hush. She's going to smack you. But she was, even his wife was offended. Said they were sitting and they weren't smiling. And we walk in and we're expecting to get greeted. There was none of that. That's not what, and I guarantee that doctor is wondering why his practice is down. Or what he's doing is what most people do, is complaining and basically they're blaming. It's the insurance company. It's Medicare's fault. It's the economy. Here's a funny thing about the economy. I got a little girl come in the office. I treat the mom and the 2 daughters. They were in a car accident, and she's 15 years old, and she's already decided within the 3rd visit she's going to be a chiropractor. But Dr. Young, I have a couple questions for you. This young lady's something. I mean, she's bright. Okay. She goes, I hope this doesn't offend you, but can I ask you, how much do you make a year? She's 15. She's figuring this stuff out already. So I kind of worked around it. I told her about a female doctor about her size in Owasso, Oklahoma, that collects $60,000 to $80,000 a month. And then more mom's eyes got big then. She said, yes, dear, you will go to chiropractic school. But so the next day she goes, I got another question for you. She said, when the economy, when the stocks on the economy dropped, how did it affect your office? I mean, she's sitting, they're working this stuff out. And then what was interesting was I said, you know what's fun about that? And this is in 2010, you know, when everything just bottomed out, when the economy went, everybody just panicked and we had all these problems, was my record year. My accountant has over 400 plus healthcare professionals. That's all he takes care of. Surgeons, OBs, dentists, all he has like one non-medical client, but everybody else is medical and goes. That year, not only did I cut my hours back, I grew my collections by 13%. He said, I'm the only one out of all of his clients that grew. Everybody else dropped, and everybody else increased their hours. I dropped my hours and increased. He goes, there's no logical explanation for it. He said, it doesn't even make sense. He said, I don't even know how to talk to you anymore. I thought it was hilarious. I said, here's the thing. Economy doesn't affect me. It doesn't affect my office. You know what else? You know what else when the economy dropped? You know what else didn't drop and actually went up in sales? You girls know? Hair products, makeup, and nail products all went up. Because people will spend money on what they find value in. And ladies, you will find value in what you think is important to you. That went up. Your patients will pay you. Now, we're going to get into that end of it, since I'm just kind of... See, Tim, I told you, I'll just roll right into it. Let's get into collections a little bit. Doctors, let's get out of the poverty complex. You deserve to get paid. You deserve to get paid. This $75 unlimited visits a month is ridiculous. How many heart surgeons do you see running specials like that? And if you think that what you do is any less important than a heart surgeon, then we need to talk. You need some valuable, one-on-one time with chiropractic, because I got news for you. We're the reason that they don't have to go to the heart surgeons. We're the reasons their hearts, don't get me wrong, they do incredible work. Heart surgeons saved one of my best friends from dying. But what my point is, we're just as valuable, and we shouldn't be running blue light specials. We shouldn't be doing that. My average collection in my office is right at $53 a visit. That's average collection. And that's cash, Medicare, personal injury, insurance, all this stuff combined is about $53 a visit. But here's the thing. It's really, really easy. Collections in the office is the easiest thing in the world. It really, really is. Here's how hard it is. I tell the patient, it's a cash patient. I'll give you a perfect example of this. This is great. We were out in Vegas 2 weeks ago, and I had one of the doctors I was talking with said, he said, man, I had like a 12-minute report of findings. He said, this guy was an attorney, and he just beat me up. He said, I never got him out of my office. Then he went out and beat the girls up, and it was just crazy. And I kind of laughed, and I said, you know what's funny is directly across the street is a little building, and there's a bunch of attorneys over there. And I said, the owner came over, and he looks just like Penn and Teller. Who's the big one with a ponytail? Is that Penn? Yeah, he looks just like him. Great big guy, ponytail. Really, he's an attorney. I mean, he's just every time he talks to you, he does this. That's what he does. And so during consultation, in the exam, I knew I was going to have my hands full with this guy a little bit. So I was prepared. So when he came in with a report of findings, and he's cash, he didn't have insurance, so he's cash, and my cash visits are $50 a visit. Between X-rays and exam and all that was, I don't know what it was, like $240. My girls do all that, I don't know. But so let's just say $50 a visit. So we come with the report of findings, and here was my report of findings. He had, what it was, he had his fingers were going numb. These fingers and his arm a little bit here. That's the only thing he had. So when I took the X-rays, C5, C6, I mean, all the other vertebrae were perfectly maintained, but C5, C6 looked like two boots. Big point out here. The anterior bone spur starting. Any doctor, we all know our neurology. I knew that's what it was going to be anyway. Well, then there's the X-ray confirms it. So when he come in, I said, John, here's the deal. See this right there? See that bone? See how square that is? See these? See how different that is? Yeah. That right there is where the problem is. That's where the nerve's pinched. Been there a long time. Because the bone's being stressed. Now, how do you know it's being stressed? I said, you ever worked with your hands and got calluses? Well, yeah. So why did those calluses come up? Because I worked with my hands. Well, you worked with your hands, but there was stress on your skin. So your body put a callus down there to adapt to that stress. That's how our body works. This is what's happening here. You got a pinched nerve. It's going to take me about 8 weeks to fix that. You got any questions? And he wanted to argue with me so bad. So you say it's a pinched nerve. Yep, that's why it's numb. And you can help me. Yep. Okay. And he laid down and I adjusted him. And all I adjusted was C5, C6. I didn't do a big full-blown dog and pony show and song and dance. I adjusted C5, C6. He walked out to the girls. The girls said, now John, I spoke to Dr. Young. He has put you on a treatment plan. And she had it written out so she's not talking in front of all the patients. And she had it written out. She turned it around. He needs to see you this many times. This is how much it costs per visit. This is how much your total treatment is. How would you like to handle that? Can I pay it in full? Yes, sir, you can. He wrote a check, $1,600 for everything. How hard is that? How hard is that? Patients walk up. Carissa says, I did speak to Dr. Young. He has put you on a treatment plan. It's going to cost you this much or for your entire treatment. Now, I don't know if you can do that here in Colorado and Oklahoma. I know some states you can't get treatment plans up front, which is ridiculous. They can do it in any other office. You know, they make you, if you're going to have back surgery, they're going to make you pay for the back surgery before you have it. I won't get on my soapbox. But anyway, in Oklahoma, we can get the treatment. And here's the thing, when they pay for it up front, a lot of things happen. They don't have to stop and get payment all the time. You don't have to ask for them. It's a lot quicker for them. It's a lot quicker for you. And they follow through. And about 60% of my patients pay in full. Because my girls say, here's how much it is. How would you like to take care of it? It's not difficult. It's just not hard. If they've got, if it is a problem, it's real simple. I can't afford all that. Well, that's fine. You just tell us what you can't afford. You don't tell them what they can afford. You don't say $75 unlimited visits. You say, you just let me know what you can afford. And a lot of times, can I pay $100 a week? Absolutely. I've got patients that pay me $50 a month. Those patients have a credit card on file. The girls just run it. Whatever it takes to make it work. But it averages out. But the point is, if you have a staff member that has a problem asking for money from your patients, ask her if when she takes her child to the doctor or she goes to the dentist or she goes to the Gap or she goes to the Limited, if those people have a problem asking her for money. No. Carissa, my front desk, she was a manager for the Limited. She was a district manager. She goes, those women walk up there and throw down $700 worth of clothes and won't bat an eye. She goes, they can pay to get their health back. And what's funny is the patients who pay you, guess what about those patients? They refer, they follow through, and they're the happiest, kindest patients that you can possibly have. It's the ones that don't want to pay you, and you've got to be willing to let those patients go. If they don't want to be in your office, work with them. But if they're just there for a coupon, or I even saw this in Kansas City one time. I was driving down the street from school, and it was a first adjustment and a free pizza on their first visit. Like, oh, chiropractic has lost its way. So there's a lot of different avenues we can take on running a practice, but I will tell you to make it as simple as you possibly can. Very, very, very simple. Chiropractic, the problem with chiropractic is it is so simple that it confuses people. It confuses the chiropractors more than anybody. That's why the majority of me and Tim had this conversation. That's why they're wanting to prescribe medications. They're looking for a way to supplement their income. They don't believe in the adjustment. When I will tell you in my office, I just adjust. I simply adjust them. Now I have two therapies, and I'm going to be honest. I have two therapies. One of them is intersegmental traction. I have 3 traction rooms, and I do it for 2 minutes. It's actually 1:58. I do that for 2 or 3 reasons. One, it helps my flow. So when patients are coming in, when we got people just coming through the door, it helps the flow. 2, patients like it. It feels good when they're laying there. It helps. A lot of times they're running or in traffic, they're dealing with all this stuff, and it makes them lay there for 2 minutes and catch their breath and prepare for the adjustment. But it's 2 minutes. It's not 10, it's not 20, it's 2. And most of the time, they walk in, they go straight there, so I do that, and then they come out in what I call a hot seat. And then I also will do I'm a licensed acupuncturist, and I have a handheld device called a Pointer Plus. It's a microcurrent unit, and I do acupuncture points. But it takes 1/100th of a second to stimulate an acupuncture point with microcurrent. So that doesn't take very long. And in Oklahoma, I don't know how it is up here in Colorado, but we have people struggle with allergies. Everybody walking through my door can't breathe out their nose, and their eyes are all bloodshot and all this. It's just, I think all the stuff that blows in from Texas is, I think Texas's fault is what I think it is. But there's acupuncture points. I've had patients literally giving themselves allergy shots for years just to get through. And I hit the 4 points, 1, 2, 3, 4. It takes about 5 seconds. And I adjust them, but those 4 points, and they will tell you, I haven't had an allergy symptom. I haven't given myself a shot in over a year. It works, but it only takes a couple of seconds. So those are the only two things that I do other than adjust. And I do it every visit, every time. So it makes things flow. You've got to answer the questions. Can you help me? How long will it take? What will it cost? You got to answer those questions. What's my problem? You've got to be nice. You've got to be kind. You've got to be quick. You've got to be efficient. Your staff has to be efficient. If I ever call a doctor's office and the CA says, I say, can I leave a message for Dr. Kirsten? Hang on just a second. Let me find a pen. In my office, they'd be fired. No, you don't. Carissa could close her eyes, and she could reach. She could reach for her pen. She could reach for everything that she needs. She could do it with, and she wouldn't even have to use her eyes. She knows where it's at. You would never ever call my office. You'll never call my office, and when I answer the phone, they're not smiling. Period. They know every patient's name, every single time. They say their name when they walk in. They say their name through the course of in their office. I say it at least twice, and they walk out. Krisha is saying thank you, and Carissa says thank you on their way out. Every visit, every time. I don't care if they come once a week for 15 years. They get treated like royalty every single time. They're in and they're out. I help my patients, and I'll get in this technique, with their coats. When you go that extra mile to be kind and be caring, but you don't have to talk. You don't. If a patient ever asks you, "How was your weekend?" "It was great. Let's see how you are." You don't tell them they don't care how your weekend was. They're just trying to be nice. "How was your vacation, doc?" "It was great. Glad to be home. Let's see how you are." They won't ask you any more questions. Don't bring up football. Don't bring up your kids. I don't have a picture of my family anywhere in the office. I do not want to generate income that doesn't have something to do with their health. I've been in other offices, and I love these doctors dearly. They're great. But, I mean, and we try to actually sneak through, and they see us, and they're in the middle of patients. And they stop to come say hi, and I'm freaking out. When I'm in the office, and it's time to treat patients, it's game on. I don't talk to you. I have doctors flying from all over the country to stand and observe, and they will stand up there and they will observe. I will not talk to them. They will not talk to my staff. They will stand quietly and they observe. Because it's those patients who come to your office, that's their time. It's their time. It's their health. It's their money. It's their health, their time, and their money, and you better value it. You better respect it. You better honor it. You better have the discipline to make sure you take the responsibility for it. If you don't, they will not refer, and they will not pay, and they will not come back. But if you will do that, if you will simply do those things and find out in your office what is 100% necessary to correct that subluxation and get that patient well, and if it's not necessary, get rid of it. If you're saying something that isn't necessary, quit saying it. If you step 2 steps this way where you could only step 1 step this way, go this way instead of that way. I was telling Tim in my office, my table, I've walked into offices and I've moved their table an inch. An inch. I've taken their trash can and moved it an inch. And people say, well, what difference does that make? See 233 people with 1 CA in 6 hours, and then you tell me. We've done it. Me and one of my staff members saw 236 in 6 hours. And when we left at 6 o'clock, my CA was done with everything. There was no stacks, there was no piles, everything was entered, everything was done. Now we were tired, but every little thing matters. And I don't care if you're only seeing 20 a day or 20 a week, it doesn't matter. If you take the time to pay attention to those details, that 20 a week will turn into 100 a week overnight. But if you continue to do what you've always did, guess what you're always going to get? What you always got. Okay? All right, that's going to be the end of the practice management. We're going to ask questions if we have any questions. If anybody needs the restroom, whatever. Seriously, no questions after all of that. Yes, ma'am. No, it's a good question. She asked about note taking. There's a software out that we use. That we haven't started using it yet, but there is a software that basically you swipe it and it's a touch screen and it does your notes. What I do is I have a travel card system to where I have a numbering system. It's kind of like shorthand to where when I do my exam and consultations, it's on that travel card, so I'll have all their information. But on their daily visits, I make just a numbered note. I don't do notes every visit. I get asked for my notes twice, 3 times a month, maybe. And most offices, if you guys think about it, if you're getting asked for notes all the time, well, then you're doing something wrong with your billing, your diagnosis code. Something's not right because they shouldn't be asking for all those notes. But what I see a lot of times is offices, doctors are so worried that they will do all these notes every visit, every patient, in case someone asks for them. Well, how silly is that? If they want my notes, they'll send for it, then I'll sit down and do my notes. I'll just use my numbering system, and then I'll do my notes, then I send it in. So sit down for 3 minutes to do 3 patients, opposed to doing it 5 minutes every single patient, which makes most sense. So you got to get your systems down. You don't have to do a whole book of notes every single time. And if you're having to do it, then there's something wrong. You need to kind of be able to streamline that and make it easier. You know, that's how I do my notes. Do what? No, and the reason I haven't been audited because we do one segment, we do a subluxation code, 1 segment. I only bill for that, and then at the end of whatever 19 or 23 visits, then I quit billing. And I've been doing it 17 years, and I see 40% of my practice is Medicare, and I've never even requested for notes from Medicare. There's red flags. I know there's offices out there, and I know the ones that got nailed and got audited. They're billing for 3 to 4 segments. They're billing for 3 or 4 different therapies. They're treating them for 36 visits and all that. Well, yeah, that's like jumping up and down saying, audit me. You don't have to do that. But there is software out there that's available, and then there's a new software in the Pinnacle group called Seamless that I know for a fact that there's using those notes. There's been doctors that has got Medicare audits, and they just sent those notes that were generated, and they pushed 2 buttons on a screen, and Medicare called them and says the best set of notes we've ever seen. So there are ways around that. Any more questions? Yes?
You said most of your new patients, 40% are children.
Hmm?
Now, might be wrong, but you're treating the parents first.
Not always.
Not always.
No.
How do you talk to the parents to get with that?
It's real simple. If your child is sitting and I'm adjusting you, I need to adjust little Corey. What do you mean? I need to check Corey's spine. Why? Because I don't want him to grow up and have a spine like yours. Okay. I'm a little different animal. I don't play games in my office. I'm serious. I take responsibility. And the way I look at it is, and this is why me and Tim are such good friends, his book, this book right here, his vaccine book, I buy $500 at a time, don't I, Tim? And I've done it several times. And every mother, every parent that walks through my door will get one of these books. And I will tell them this, read this. It's the single most important thing you will ever do for the health of your child. And then get them in here. And I give them out. I mean, I've spent, I don't know, $2,000 or $3,000 on books. I don't care. I'll spend $200,000 or $300,000 if it means saving the life of a child. And that's how I feel about in my office. I simply tell them, we're treating your kids. I've even told a mother one time she couldn't come back unless I treat them. The child was sick. No, I'm taking them to the pediatrician. I started twitching. You're doing what? How many times have you had her to the pediatrician? Well, several. Is it working? No. Then why are you continuing to do it? If you don't let me take care of her, you're not allowed back in my office. I said, that's how much I care about your child. That's how much I care about you. You want her well or not? I've got a good one for you. I had a dad come in. He's a stay-at-home dad. This happened this last week. Little girl, her name's Joy. She's 6, 5. No, she's not in school yet. 4 or 5, whatever that is. Joy was having allergies. I mean, her little eyes were just as bright red as they could possibly be. She's sneezing, she's coming, but she's bouncing off the wall. He came in, I said, we need to take a look at Joy. And he says, no, not today. Maybe tomorrow. no, maybe I really think that we should take a look at Joy right now. She's allergy, we can fix it. So before he could even say anything, I picked her up. And I'll show you in technique, but I just, underneath the arms, my thumbs are on T1, T2, T3, parasympathetic nerve supply, ganglion to the immune system, made that adjustment, set her down. He comes back in the next day and he said, I got to tell you something. He said, you made my wife a believer. He said, she was at the house when we left, and by the time we got home, Joy's symptoms were gone. Her allergies were gone. And we kept waiting for it, because normally we're having to put her on this and on that. And I said, well, of course they're gone. He goes, you don't understand. My wife's a medical doctor. She teaches at St. Anthony's. She teaches the MDs and the DOs. And she goes, I don't even know what to tell everybody. She goes, all I know is she had allergies, she got adjusted, now she don't. And I said, well, tell her to remember physiology. He goes, I'll tell her that. So I don't know how that went over. So, but I don't play any games. You just tell them, I'm going to treat your child. Now, in my waiting room, out in my waiting room in my little hot seat area, I have a TV, and it's got a PowerPoint, and I've taken pictures of me adjusting my kids, and I've got, I don't know, 40 or 50 of them up there. So there's a picture, and then like 15 seconds later, another picture, and then I have a saying, you know, your children have spines too. Let's make sure we check, or whatever I want. You know, I've got some stuff about ADHD, that, you know, or psychotropic drugs. I've got things that you want your patients to actually know. But between each saying or each phrase or each referral statement, you know, thank you for all the kind things you say about us. I didn't get into that in practice management. That's another thing. But you know, referral statements. But I have pictures of my kids, and when patients come in, they see that and immediately they relax. I have it in my waiting room. So new patients that have their kids, they'll see that, and they'll see me treating all these children, and they'll see these things about why it's important, and then they go up to the front. Can I get my kids treated today also? But I take that stuff serious, because now after 17 years, I've got my little ones bringing their little ones. I've got second generations coming now. It is a huge honor. It makes you appreciate and revel in the power of what you do. Be able to adjust a child and change their life to such a point to where when they become an adult and have their own child, the first thing they want is their chiropractor to lay hands on that child. It also makes you feel very old that now that their babies are having babies. So yeah, did that answer your question, Mike?
Probably I don't know the answer, but $50 cash for kids too, same price.
Yeah, and here, you know what? Most of the time on my children, most of the time on kids, it's a family. Rarely, man, I don't even know if I have any. Maybe a couple, and they have insurance, so we just do copays. But a lot of times at families, if it's cash and it's a mom and 3 kids, and I'm glad you brought that up, because I should have made that clear earlier. If it's a mom and 3 kids, I'm not charging them $200 a visit. So I'll do a lot of times, depending on the situation, you know, if they just can't afford it, I'll do like, you know, $50 for mom and $10 a visit for the kids. And there are times I'll do $50 for the entire family. But here's the thing. I can treat a mom and 3 kids in about 3 minutes. So when you break that down, if I'm spending 45 minutes with them and only making $50, well, then your day drags out and you haven't done very well. But if you're adjusting them and getting them well like you're supposed to, then it really doesn't matter. Then you see, and I have a lot of patients that, you know, you think about it, I have some patients that pay $50 a month for their whole families. That's all they can afford. Bless you. And so the thing is, they're coming in, so if you was to go per visit through that month, they're not paying very much, and I still average $50 a visit. So it all works out.
Treatment plan for kids, I know it depends on what they have on the average what.
No, on kids it's normally 12. It's early. Depending on what it is, though, I have some. And you guys, some of you have heard some of my stories, and I'm going to try to get into it on technique. But I've got some really spinal deformities. I've got some kids with genetic disorders. Now it's 3 times a week for 8 weeks, and then it may be another 8 weeks, and it may be another 8 weeks until we get those kidneys to actually start responding, or we get those organs to wake up, or we get whatever it is. Because here's the thing, I believe, and me and Tim had this conversation. With everything I have, I don't care what comes into the office. I don't care if you have a 6-year-old that they're wanting to do kidney transplant because the kidneys aren't, they're having to go to dialysis and they're having a cath and they're having to do all these things. I know in my heart, if I make that adjustment and I continue to make that adjustment with the right intention, with the right thought, those kidneys are going to respond. I know it. It's not I believe it. It's not I hope for it. I know it. I know it. And that's why I get so many of those patients in. because you can use whatever words you want to. My belief is God knows it. God knows who's ready. He knows where He needs to send His people. And I tell patients that all the time. I know you're going to get better. God wouldn't have sent you here if He didn't think you would. You're not here by accident. And I believe that. I believe it with every ounce of fiber that I have. That's true. If it wasn't, I wouldn't be having all these people pour in my office by doing nothing but making an adjustment.